Yeah, we have.
In basketball, team in a small space.
Oh, man. Oh, Hoping not to. You're actually not, you're not. Yeah, it's like, they, I don't see, wow. Oh, yeah. Good evening, everyone. Welcome to our March Community Advisory Board meeting. It's wonderful to see you all. I'm sure we're all just taking a moment to dry off and get situated. And so without further ado, I will jump right into this. And if we could proceed with call to order and roll call, that would be wonderful. All right, roll call. Member Barnett.
Here.
Member Shan. Member Diaz de Leon.
Present.
Member Holter.
Here.
Member Wong.
Here.
Member Inocencio. Member Lynch.
Here.
Member Rom.
Here.
Member Rodriguez.
Present.
And Member Sierra.
Present.
And Chair Weeks. Present. Okay, let the record show that everyone is in attendance except Member Inocencio and Member Shen. Great, thank you so much. And with that, we will proceed to public comments. There is no public comments at the moment. All right, wonderful. And we still, correct me if I'm wrong, do we have the virtual option available? I don't recall seeing that or not. Or no, it is here. We do. Never mind. Question withdrawn. Thank you. All right, with that, we'll move to the approval of the minutes. Do I have a motion to approve, or is there anything that someone would like to flag?
Motion.
Do we have a second?
I second.
Great, let's go to a roll call, please. After the public comment, I almost forgot. Again, there is no public comment on the minutes. Great, all right, now roll call, please. All right, so Member Barnett.
Approve.
Member Shan.
All right, Member Diaz de Leon. Member Holzer.
Abstain, I wasn't.
Member Wong. Approved. Member Inocencio. Member Lynch. Member Ron. And Member Rodriguez. Member Sierra.
Approved.
And Chair Weeks.
Approved.
Thank you, everyone.
All right, we're moving right along. The next thing on the agenda is cab announcements. Do any of my fellow cab members have anything they would like to raise at this moment and share with the community or our internal group here? Member Diaz de Leon, go ahead.
I have a couple of events that I'd like to announce. One is taking place Saturday, April 8 at the Mitote Food Park area over on Sebastopol Road. And it's going to be a health fair being put on by the County of Sonoma. They're still bringing together all of the partners and putting together the details, but this is going to be a place for folks to learn about where to obtain vaccines, where to get healthcare access, and lots of other things related to health. So I'll send that flyer over to the community engagement team once I receive it. And then the second one is Four Seasons putting together an event on April 22nd, Earth Day. That's going to take place in the Stony Point parking lot right outside of their office. And it's meant for families to learn about the services that they provide, meet people from the different daycare centers, and just be able to ask questions from the staff. So I'll send that information along to the community engagement team as well once I receive it.
Terrific. Thank you for sharing. Looking around, anyone else? Member Rodriguez.
I do, before our next meeting, but Earth Day is coming up, so thanks for mentioning that. I do hope everyone comes out to the square on Saturday, April 22nd from noon to 4. There will be tons of activities. I know the city's putting in a lot of work to promote all the environmental programs and community organizations. So it's in downtown, it's around the square. Hopefully we can all pop over on that Saturday between other events, of course. Thank you.
I will undoubtedly be there. I don't really have an excuse since I live downtown, so. Yeah. Looking around, any other members? Member Hopler.
Yeah, I just wanted to share, I know there is a lot of concern in the communities of folks who are doing agricultural work right now because of all the rain and because of the season in general. And so I wanted to announce that there is some financial relief in the community and nationally right now from the USDA. They are providing $600 per agricultural worker to anyone who worked in agriculture between now and January 2020. So even if they're not still doing agricultural work, they can apply for this funding. Questions about documentation in the United States are not asked. The funding is not taxable. So it's a very flexible funding that is available. Folks can look it up, they can Google it by typing in USDA Food and Farm Workers Relief. And I know that the United Farm Workers Association has some that people can apply for online. But Googling that, you can get more information because there's many agencies that are getting that out nationally right now.
Wonderful, thank you so much.
Or any other web browser you may choose. Sorry, I don't mean to make that. I'm not a Google employee.
It's always good to show for those large corporations. All right, does anyone else have anything they'd like to share right now? Not seeing any immediate hands. And I can't honestly think of anything off the top of my head. There was one thing I forgot to ask staff beforehand. This pertains to a comment or something we discussed last month. Because I did actually have a neighbor that was interested in this, where can you pick up graffiti kits if you want to participate in taking down graffiti on like public spaces, private spaces if permitted?
You can reach out to our Public Works Department, James Castro. is going to be the staff person specifically, and we can make sure that we forward you the email address that folks can use.
Great. I had a crazy amount of interest actually from people. Yeah, they're very interested in engaging, which is wonderful. It's exactly what we want to see. That is actually all I had to share. So with that, I will look to public comment.
Again, we do not have public comment, but I have to let everyone know that David Shen is online, but he didn't inform us about disclosing his address, so he will not be attending today. But that's it.
I didn't, oh, so that is, yeah, that's right, that rule's in place now. I think that's probably a good reminder. So thank you for that, and it's unfortunate, but it is what it is, we know now. Great, so with that, we will move to item number 5, staff updates.
Thank you, Chair Weeks. Darielle Dunstan, Assistant City Manager. I have a couple of updates. One, I'll just remind everybody that Daniel Shaparo is going to be you all's recording secretary and working closely with you all for any administrative needs. And I want to introduce my colleague, Lon Peterson, who is our Director of Communications and Intergovernmental Relations. He is going to be the staff liaison to this body. I will be attending periodically, but your main point of contact moving forward will be Mr. Peterson. And I also want to announce that Danielle Garduno, who many of you know, has been appointed interim program manager for the Violence Prevention Partnership. And so she'll no longer be staffing this body, but we're super grateful that she's still with the city and taking up what is a huge task. And so with that, I'll turn it over to my colleague, see if he has any words.
Thanks, Dario. I appreciate it. So yeah, welcome, Lon Peterson. I do oversee the Communications and Intergovernmental Relations Office. Looking forward to working with you guys more closely. My plan is for these meetings is to come with all things city events and opportunities to volunteer. And I'll be talking with your chair about other things to be sharing, but like just moving forward, one of the things I'm doing in our office is getting more organized around our communications. We're trying to get ahead of it a month or so out, and the stuff that we do, I think it helps us from an organizational standpoint, plus the city overall, to then extend our reach to the public to make sure that everybody's informed on the same page and easier to find information. That being said, I do want to highlight a few things that are going on in the community. Saturday, April 1st, 10 to 1, Spring Fest. It's presented by the Neighborhood Services Division, Santa Rosa Park and Recreation. It's the free and it's low-cost recreation opportunities for underserved Santa Rosan children and their families. You have to be a neighborhood service member to be invited to this particular event. It'll be egg hunts, pancakes, crafts, and a lot more. The event is free, as I mentioned. You have to pre-registration is required, and you can find more information on our website, srcity.org/neighborhoodservice. Next one is a springtime fun at Courthouse Square, April 2nd, 12 to 2. That's in conjunction with the fire department, police department, partnering with Sonoma County Park and Recreation. This event is for kids to get some springtime goodies and meet the Easter Bunny. And again, you can find out more on the city's website, as well as the fire department and police department's Facebook pages. I'm going to skip over Earth Day. We are hosting Earth Day, lots of stuff. Yep. Woo, woo. Lots of stuff going on there. Super excited about it. You can find out more about that /Earth Day on the city's website. And I'll talk about volunteer stuff, and I'll highlight that because there is opportunities to get engaged in that in addition to just going. So volunteers, one of the things that we just kicked off in Santa Rosa is called Clean Santa Rosa. It's a new monthly community cleanup and beautification program where the community volunteers and city staff can work together to clean up public spaces in Santa Rosa. This month, we're happy to partner with Caltrans. They're doing Clean California Community Days, which is an 11-day statewide beautification event. It begins on March 17th. So the next opportunity for local volunteerism is Friday, March 24th, 10 a.m. We're going to be cleaning up Morgan and Davis streets between 3rd and 9th, as well as the next day on Saturday, Saturday the 25th, starting at 9 a.m. We'll be cleaning up litter and debris and removing graffiti from Martin Luther King Jr. Park. And all that information can be found at srcity.org/cleansr. Moving on, Park Month volunteer opportunity, April 8th. So this month, Workday will be at Franklin Community Park. These are family friendly events with tasks such as picking up litter, spreading mulch, and cleaning playground equipment, barbecues, lots of other stuff. So it's a great way for students to earn community service hours, and anybody can sign up at srcity.volunteerhub.com. Speaking of Earth Day, the city is looking for volunteers for Earth Day on the 22nd, 4 to noon at the Courthouse Square. Volunteers receive an event T-shirt as well as a reusable take it from the tap water bottle, and you can sign up for that at srcity.org/birthday. Actually, two quick updates. Water supply. So with all the rain, obviously you guys are very aware, just even coming in here, there's lots of rain going on. So it's great for Sonoma County. It's awesome for the city. Both of our reservoirs that we get our drinking water from are full. So as a result, the council has rescinded the water shortage emergency. Sorry, yes. So that was in place since June 2021, and they just rescinded that. And so while it's great that we have all this water, we're still conscious and making sure that we're saving water. And just so happens that this week is Fix a Leak Week. And so if you have 10 minutes to spare, you can crack down on water waste. And we have a 10-minute Fix a Leak Week challenge on our website. So those are my updates. Any questions?
That is excellent branding. I appreciate that. Amy, do you have a question? I don't think there's anything. I'm going to say, you know what, go for it.
I apologize that I didn't say this earlier, but the COAD, the Community Organizations Active in Disaster, is forming a long-term recovery group for the winter storms in January. So if any members of the community had impacts to their home or were displaced by the storms or are still experiencing impact from the winter storms, they can contact the COAD or they can contact Catholic Charities or CAP Sonoma, who will be doing most of the case management for that ongoing recovery effort.
Wonderful. And I guess actually I kind of forgot to say, I did start meeting with at least a couple CAB members. I had promised to get through all of them. Sadly, the month got away from me. I apologize. Don't know where the time went, but I will diligently try and get it done before next month and connect with you all so we can kind of all just level set and figure out how we want to move us all forward. Thank you for all those updates. Does anyone have any questions pertaining to what Lon just told us? Everyone good? Go ahead.
What day was the Franklin Park cleanup?
It's April 8th, yes? And they're usually like what, 10 to 12, 9 to 12, or something like that?
It is noon to 4. Oh, sorry, that's Earth Day. It's Parker Month. Yeah, 9 to noon. April 8th.
Yeah, they're a lot of fun. I've been to quite a few. Usually, I'm sure many of you know Logan Pitts also happens to be chair of community services is usually there. So I certainly encourage you to come out. It can be a little challenging, but it's usually a lot of fun. You meet nice people. So I really enjoy them. All right, I'm looking around. I'm not seeing any other immediate hands raising. And thank you for the information about the volunteering for Earth Day. I will definitely take a look at that. I should be available. So I'll be sure to sign up. And I encourage the rest of my members, if they're available, hop on board. We'll have a good time. And with that, I will move us to, yeah, I don't know about public comment. Public comment, please.
I see no hands raised for public comment.
Great, thank you. All right, wonderful. With that, we will move to item number 6, schedule items, and I think we have some guests joining us today for a presentation. So with that, I'll let you take it away.
Hi, good evening. I'm Katie Swan. I'm the program director for In Response for the city of Santa Rosa. And I thought we'd have a conversation today about kind of In Response. Is everybody familiar about In Response? Heard the name? Even the next slide. So In Response is a mental health crisis team for the city of Santa Rosa. Our team is made up of 6 different partners. So we have the Santa Rosa Fire Department. Oh, I'm gonna back up. The Santa Rosa Police Department is a big partner of ours. And we work with their dispatch team on a regular basis. The Santa Rosa Fire Department, we have paramedics on our team. We have Sonoma County behavioral health clinicians on our team. And we have engagement specialists from Catholic Charities that specialize in homeless resources and services. We work with Humanidad Therapy and Education Services that have system navigator on our team. And then Buckaloo Programs is where I am through. We have myself, a team leader, and several community navigators on our team that kind of provide wraparound care. And I'll kind of get into the details of that as we go. So our In Response team works within the city limits. And we have 2 units or vans that they're essentially vans that have that run. One van runs Monday through Thursday from 7 a.m. to 5 p.m. And our other unit runs 7 days a week from noon to 10 p.m. Our goal, we started a year ago. We started with our first unit that noon to 10 p.m. and then we added the second. And our goal is to be 24 hours a day, 7 days a week. We are getting closer to hitting the 15-hour mark. Hopefully by May. It's that's our hope. We have to onboard more staff. So on our team, we have on our units, we have 3 staff that sit on our vans every day. So we have our behavioral health clinician that can do assessments on our team that sits on our van. And they also can, in times of need, do a full assessment and determine if somebody is needing to be placed on a psychiatric hold to be evaluated for further care at a hospital or a crisis stabilization unit. We have our firefighter paramedic that sits on our unit and that can provide the medical aid and assistance. And then we have our engagement specialist that sits on our unit as well that can provide those services to folks that are at risk of losing their housing, have some concerns around housing, or without housing, and provide other resources around that. And so those are the folks that sit on our units during those times. And then we have 5 community navigators that all provide wraparound care. And so a big piece of our navigator, the role is that we have brought on individuals with lived mental health experience or have had substance use experience challenges in the past or have been a family member of somebody that they've supported, because we really wanted to have another type of service and support to offer our community. Because we have that clinician on our team, we also wanted to have somebody that's already navigated our system of care. And so what our navigators do are really able to provide one-on-one support, education, and system navigation to folks based on what they're experiencing. and be able to walk them through that process. So that might be going to the store or the pharmacy to pick up medication. It might be helping get a doctor's appointment. It might be helping a family understand what is mental health, what is a mental health challenge, or what that means. How do you access care? How do you find primary care? So anything and everything that it takes to support somebody, our navigators do. Slide. So a big piece of our team is kind of also like being human first, right? So I don't know how many of you know of the Cahoots team in Oregon through Whitebird Clinic. We met with them before our program started over a year ago and learned from them, talked to them about kind of what services they provide. They've been doing mental health crisis response for about 35 years. And so we heard them and heard a big piece of it was how you engage, what your van looks like, what uniforms you wear, right? And so we took from that and then worked with our community and had a community advisory team to even talk to us about what the logo should look like, what the colors should look like. So this is, you'll see images of our van. So it says in response, underneath it says mental health support team. We got community feedback that they felt that might be stigmatizing. So they asked us to remove the mental health support team. It's still on our uniforms and our information, but not on the side of the van. So that's a little different. Our uniforms are jeans, tennis shoes, and a gray t-shirt, polo t-shirt. And then in the back of our van, you'll see that we have all of our medical equipment. So that's not what somebody sees when we can drive folks places too, right? So, but we wanted all of our medical equipment in back of the van. So that's not the first thing you see, right? Next slide. So so what is our team, right? Like, what do we do? Where do we respond to? So the types of calls for services. So the reason folks would call us. So there's two ways to call us. You can call 911 or you can call our specialized phone number, which is 575-HELP. To call to ask for support. So you can call if you yourself are experiencing a mental health or a substance use crisis and are needing help around that. You can call if it's a family, let's say, that is calling, that is needing help for their loved one or the whole family unit to be able to get different resources and supports around mental health, substance use, or housing. And folks that are under the influence and are needing to get to another next step. They might want to go to detox. They're having some challenge around that and needing support. Individuals that are in crisis and are at risk of losing their housing or unhoused, we can also support folks in those moments as well. If somebody, a community member, a family member, somebody themselves are struggling and needing to provide, like to do a welfare check. So go in and check in with somebody to see how they're doing and what's happening. Our team can go do that as well. And we do a lot of other things too, right? So we do crisis work, but we can also intervene when there's a situation that might be urgent. So if somebody's calling and saying, my best friend is struggling, they just missed their therapy appointment, we don't know what to do. And like, we could really use support right now to do an assessment, right? Or go pick up their meds before they visit their doctor, right? So our team can be able to help problem solve in those moments with those individuals to get to that next step so that they're not hitting that crisis level of care, right? So I kind of touched on this a little bit. How do you have in response show up, right? So anybody can call 911 and that will get you to the Santa Rosa Police Dispatch Team. You can also call 575-HELP, which also brings to our dispatch team. But what it does is in response has its own alarm. So anytime somebody calls 911 and the dispatch center alarm goes off, right, to let them know that another call came in. When you call our specialized number, it has a separate different ringtone. So it gives the dispatcher in that moment, oh, this is a mental health or substance use related call. And they answer with in response, right? Which is a really important piece than Santa Rosa Police Dispatch, right? I have my own lived mental health experience and I have kiddos that have bigger mental health challenges and I've had to call 911 to get help for my kiddo because I couldn't help them in that moment. But having to call as a parent, to call law enforcement is really hard, right? When you can't meet the need of your kiddo. So it's really helpful when you call and they answer within response, and that puts them in that mindset that there are screening questions around mental health and what to do, right? Majority of the time we can respond on our own. We're a civilian team, right? So anytime that there's no threat of like violence or somebody's behavior might be escalating and they might become like having more like of aggression in those moments based on their symptoms. Or if there's weapons involved, those are the times that we can't respond by ourselves. So let's say that there has been concern that this person is escalating a bit and we're a little unsure about safety, right? So if that's true, then we can co-respond with law enforcement, means that both in response and a police officer will go out together. We talk beforehand and we go in and to make sure that the situation is safe, right? So law enforcement can go in and talk to folks at the place we've been called to and make sure that everyone is safe. And then once that happens, then law enforcement is able to step back and our team is able to take the lead. There are many times that everything is safe, law enforcement steps back and they're actually able to leave a call altogether. And so it's just our team. Once in a while, if there is concern of safety for those same reasons, we might be asked to stage, right? So that law enforcement goes first. We're a few blocks away. I'm waiting for the call to come to the address that we've been called to. And we've done that several times too. And we ended up working really well together. Even at one point, law enforcement was able to leave, right? So our goal is to have a non-police response when we're able to do so. So this is our day, our ribbon cutting day. So we have been running, like I said, for a little over a year on this. This was, I think they had been planning for about 2 years prior to this for this launch date. So this is just a good memory. We actually took calls that afternoon after the ribbon cutting. And which was pretty cool in the fact that like we're 6 organizations, right? So we all worked in our own organizations, but we brought 6 organizations together and said, okay, let's work together. And we were not quite sure how that would go, but it actually worked really well. And we became a family really quickly. So I just kind of wanted to go over just give you a general idea of the number of calls and different data that we pulled. So for the first year, remembering that we started mid-January and that we only had 1 unit up until we had 1 unit for most of the year. And it was late September that we added that second unit. So you'll see our numbers increase. So for the first year, we ran 2,893 calls per service. And then we broke that down kind of by the type of service. So the primary service that we provided. So anytime we go out on to a call, we track what type of services we're providing. If that's a mental health related service, if that's a medical related service, a service related to homeless resources and services, substance use services, or system navigation. And so what you'll see overarchingly is we're providing, the green is the primary service. We provided primarily of mental health calls, right? Secondarily, it was homeless services. And so the green is primary, the blue is secondary. The thing that you'll notice our substance use services are lower. What we realized is that we were learning what to track when we were actually going to each call, right? The first year was definitely a learning process for us. And what we realized is that we actually should be tracking calls that we're going out to that we're providing co-occurring services. So somebody that's having mental health and substance use needs, and we're providing a service around that. And so that's why you'll see that this being our substance uses services are lower. And then the next slide you'll see is the diversion calls. So we were able to divert law enforcement 1,762 times. from a call from service. So that means that we went alone or that we got to a call and we were able to release them and they were able to go to a different call. We diverted 121 folks going into the criminal justice system. So that's custody, that's a citation, that's a ticket, court date, things like that. We diverted 677 calls that would have gone to a fire truck or ambulance. Again, that means they might have arrived, but we were able to release them. Right? And then we diverted 152 folks from going to the emergency room. We were tracking a lot of our data by hand when we started, and then we moved over in June to an electronic tracking system. And part of that is that number is probably higher. That fell off when we moved over to our electronic system, so that number is lower. And then to touch base kind of a little bit more about our navigation side, right? This is one piece that we learned from Cahoots, right? Cahoots was doing the mental health crisis response in Oregon. The thing that we kept hearing was the wraparound care and why that was so important, right? And so we, as a community, decided to move forward with that because and having it be somebody with lived experience or that is a family member, because they know what that's like to be able to walk through a system of care, to be able to get support, to talk about what it is to have that experience and what was helpful for them and what might have been the challenges, right? So Humanidad Therapy and Education Services and faculty programs works together to have our navigation team. We are our team of 5 of navigators to provide that support, like I talked about, to be able to make appointments, to be able to talk about what it might be like to call a therapist for the first time and the anxiety you might face in that, right? Education about how the system works, what mental health is, what type of support you can get for mental health. And then the system navigation, actually navigating through the system of care. And this is our system navigators numbers for the year. So this is outside of the calls that we just saw, the data that we just looked at. Folks for our navigation team can access our navigators in multiple ways. So our team goes out in the van and provides support to somebody, and they can ask, are you interested in follow-up from our navigation team? They say yes, a referral is made, and then our navigation team follows up with those folks. Folks can also call us directly and say, hey, I'm really struggling, I'm needing support. Can you help me? And so we can help those folks. The parameters are they have to be in the city of Santa Rosa for us to be able to do that. But our goal is to do the preventative work too, not just the post-crisis work, right? So if we can help somebody get connected to services before they hit the level of needing our crisis response team, then we want to do that work too, right? So overall, our team saw 494 unique individuals over the last year. We added more navigation positions about 7 months in because we saw that there was such a big need for those services that, I think that we'll continue to see our numbers increase. So we saw 494 unique individuals for the first year. And amongst those individuals, they had 2,367 contacts throughout the year. And I wanted to just break down a little bit some of our service types that are offered by our system navigators. I'll talk through a couple of them. So we provide a bunch of different things. So personal support, helping somebody kind of learn what their choices are and provide that support to make, like, I have anxiety calling my therapist for the first time, like providing support around that, right? Or a family member trying to understand what's happening and providing personal support around that. So they, provided 1,027 appointments related to personal support. We've referred folks to support groups. Our navigation team will be out. They do visits over the phone, in person, in the community, home visits. And at times when they go out to do a home visit or in community, somebody's actively in crisis. And so our navigators support them and then bring in our in response unit two to help with provide that services. So they did 185 contacts that were related to crisis intervention, system navigation, doing that, navigating through the system of care. They provided 409 referrals into community. And they do a lot of follow-up. I'm going to skip through some of the smaller ones, but they do a ton of follow-up too, right? Like somebody might book an appointment, we might follow up with them to see how that went and what the next step is and how they help them, get connected to other services. And then they do a ton of care coordination too, right? Let's say that we'll use my son, he's been hospitalized and needed help. Like we needed help around discharge planning, right? So if he was hospitalized, he gets discharged, what do we do now, right? Like, how do we navigate through that? How do we engage with the school district? How do we have an emergency reentry meeting? What other supports we can have, right? And so our navigators do a lot of that care coordination with families and individuals to kind of figure out those next steps and bring a care team together. The overall goal is our navigators can talk to somebody once if they just needed a resource, or they might work with somebody for 6 months to be able to get them kind of connected to natural supports and to different community resources. The goal is to be able to stabilize folks in their community and with their natural supports to be able to, go back to the things that they want to do and engage in. So that's kind of numbers around that. So some of our successes over the last year that we've learned is that our team was cohesive really quickly, like I said, right? Like I honestly was a little like, oh, how we do this, right? 6 organizations, all kind of different schools of thought came together and it's worked really cohesively. We've had pretty good success collaborating with other partners and community. We've seen increased calls, right? Because that was part of my concern too, right? Is talking about how to access us, what we are, what we do, the stigma around mental health, right? And so the more outreach we do, we've seen our calls go up, which is a really good sign. And like I mentioned, right, there was such a big need for the navigators and so many community members like, hey, can I have some support too? That we are able to add a couple more positions. And some of our challenges, like our growing pains over the last year, was data collection. I kind of talked about that, right? We started off on handwriting out everything on paper. Part of that was reading each other's handwriting. That was a thing. Acquiring the vehicles. The pandemic really made that challenging. We ordered our vans, I think, a year prior to our team starting. And the chips that they had for them, they weren't manufacturing, so we had to wait a while. So that was a big piece of that. Staffing is an ongoing thing to be able to hire enough staffing across, I think, any position in most industries. At this point, it's hard for staffing, but there's a 30% at least shortage in mental health related positions. So that's been a challenge for us. And then with that, expanding our hours of operation, right? Because we need the staff to be able to expand. And then shameless plug, if you know folks, send them my way. We are hiring for most of our roles. We just actually filled our community navigator roles. But we still are looking for clinicians, paramedics, and engagement specialists. And then this is information, again, how to access us. I think you'll all get the slides. For crisis, 575 help, 911. We have a navigator line that is up there that you can call directly. You can also email us at the InResponse at SR City to ask questions. And then we have our website as well. And that's kind of it. Do you all have questions for me?
So there's no phone number on the van. Is that by design, or if I've seen the van out there, I'm thinking, so we had an issue in Copper Park where there was somebody who was in the street. I wouldn't know, so it's great to know to call either one of those numbers. I called 911, but is there it would seem like there should be a number on, like, is it a van you can call or no?
And that's a good point. I think beginning wise, the advisory group kind of all talked about different ways of how to put the logos on the van. And so they came up with that in response piece, but that's an evolving piece. I thought about that as well. We'll bring that back up. I know that we have stickers on the city buses with our information on there as well. Yeah, that's a good point.
And then my other one was mutual aid, because in the city of Santa Rosa, there are some county blocks, right? How do you navigate that where, and especially if it's homelessness where there's no boundary there, but I mean, if it's someone that lives in the county or lives in the city, I can see like a family member, like you said, that would be easier to help.
Yeah, good question. So we do aid at times, right? It kind of depends on where our unit is at, the number of calls we have, right? In queue, right? Sometimes we might have 2 calls in queue. Sometimes we might have 14 calls in queue. So it depends on what we're doing, where we're at, and how that's all happening. So we have gone out to those little pockets of county land, but we also refer to each other too, right? And so we have the mobile support team that sits on our team, but they also are working in county pockets. So we also use them and aid in that to go out to those calls that we aren't able to get to as well. Part of it is just having enough bandwidth to cover all of the areas in the city alone.
And to that point, those unincorporated county pockets, there are services that folks need in addition to in response. And so we're having those conversations with the county to better partner with them, to better serve those areas. And so we'll continue to bring up not only the points that you've raised, but how can we deliver better services to, at the end of the day, the residents, right? If folks need help, they need help. And they don't care if you're a county employee or a city employee, they just want help.
Yeah, and a good example of that is we'll have folks that are maybe without housing, right? That were in Petaluma yesterday, end up in Santa Rosa today, right? And then end up in Rohnert Park the next day. We've also partnered with the SAFE team, which is another response team, right? To be able to help get folks from Santa Rosa to Rohnert Park if there's a shelter bed or vice versa, right? So we're all about collaboration. That's a really big piece of us is working together because it takes all of us to serve our community, right?
And thank you. I mean, I've personally seen the results in family members and as well as the neighborhood. So thank you.
All right, I'm looking. Member Holter, go right ahead.
I'm just curious about your funding and if that's something that is built into the city on an ongoing permanent basis, or if it's some kind of pilot that we need to vote on in future.
Yeah, so we have several different funding streams, right? And it was for the first 3 years. So we have state funding, federal funding, local county funding. And so that's an ongoing process to look for continued funding, right? Ongoing, but the city council is in full support of continuing our program. So we're not gonna end at a certain endpoint, right? It's just looking for more opportunities and more funding as we build out and grow.
And to that point, just to underscore the city's investment, we were searching to find a permanent home for the in-response team. And before I came to this meeting, I was actually at a building that we hope will become the in-response team's permanent home. We've got some renovations that need to get done, but hopefully they'll be able to move into that permanent space at the latest by the summer. And so we're not going to make that type of investment if this isn't a long-term strategy.
I'm going to do something you're not typically supposed to do. For 1 second. Because it's related to that question, I just figured I'd dovetail off of it really quickly. Yeah, because I'm interested in kind of the flow of kind of, the finances in terms of what you guys do in terms of helping other departments free up funding for them, or I don't even know if that necessarily does free up, funding for them. I'm curious if like all of this, I would imagine just some extent, in terms of budgeting, this is tracked. And that you're seeing the impact of the work that you're doing in terms of bringing up resources elsewhere. Because I am also very curious about the long-term, financial support. I know I've talked with Chief Cregan about this. I'm in total support of investing heavily in community response. So I don't know if that's like too broad.
Yeah, I'll take it first and then turn it over to Katie. As you saw on some of the slides that were presented, right, this program is still in its infancy. And we all know when it comes to data analysis, you want a good set of data. And so we're still collecting that data. And we'll try to unpack all of those nuances that you've mentioned, Chair Weeks. But the reality is we probably won't see a good trend until we have probably about another year's worth of data. If you can go back to that diversion slide. So I've worked in the city of Oakland, and I'm an East Coast native, and I've been in communities that have had negative interactions with law enforcement. And I can't highlight enough, right? If we can get to that diversion slide. I can't highlight enough, right? The positive impact that the M-Response team is having, that where we are diverting folks from law enforcement interactions. Look at that, 1,762 people, right? That's almost 2,000 people that may have been in the system, if not for the M-Response team. And we're only gonna see that trend continue in a positive direction. And so this model is a model that I believe other jurisdictions can look to. Other jurisdictions, I think we can scale because we know just nationally, right? There is this tension between law enforcement and the general public. And I think we're showing that we don't always need to lead with force, and that if we address some of the other issues that are going on, that we can prevent some, and I'll just call it out for what it is, we can prevent some of these deaths that are occurring. And at the very least, we can prevent some of the assaults that are happening. So I really want to commend Katie and her team, their team, my apologies. And I can't say enough of how much we believe in this model, and we'll continue to support it.
Thank you. I appreciate that very much. Yeah, and I would just say too, part of it, right, is the diversions alone. Like it's not going to give you a figure for numbers, but what it's going to do is like it relieves law enforcement, EMS, and fire to go respond to medical aids, right? So if we're able to show up and relieve somebody that we can call, that we can support somebody in, we're going to deliver the right level of care at the right time, and then we're going to allow for my grandmother, if she's having a heart attack, right? They can go respond to that call. So just the cost savings and service delivery is a huge.
And it looks like you're on the cusp of being able to show the cost savings in terms of return on investment, because you're going to have all the data that you need to turn that into dollar figures. So that will be really exciting to see.
Yeah, absolutely. Like as our data collection gets better, we're working to build out a countywide database system as well, for one of our grant funders and partners to be able to build that out so that we're not just tracking data across our own program, but across programs across our county, because then we can also see there's going to be certain pockets that we're serving that another program is not serving, right? So then, because it's going to take all of us to be able to provide those services. So that will also give us a really good picture of what's happening in our county.
Member Burnett?
So I'm going to make the grand assumption that between 10 p.m. and 7 a.m., the responding agency then goes to SRPD if a call comes in. So my question is then in the morning, when the morning team comes in, does that response team, does SRPD then contact your office if there are calls during that time frame that would make more sense for your team to have tackled? That's my gap question, because you don't have 24/7.
Yeah.
And what's the word I'm looking for with that? And then how do I put that? Like, So one of the things that we deal with is culture. And so I'm just trying to think of like, when you're working with these other departments, you were lucky that the team all came together and there was cohesion. But my question is that you are a multi-partnered agency. So that's my other piece, is that we probably won't see this until the next year out, or potentially further out, of other departments or other responding agencies knowing that they can call you. Because I see this as the key piece of people just not knowing that, oh, in this situation, right, we could have called. And that's my other piece, is the marketing and the outreach side of it, of just letting the other interagencies know. Because one of the things that's happened since the disasters, and you can testify to this, all of our first responders just take it. That's just kind of been the culture, and they're exhausted, but they just keep absorbing, keep absorbing, keep absorbing. And I don't necessarily know, like, has that been something that's been explored? It could also just be, you're like, we're just trying to get the team going and staffing with that, of letting the other agencies know that this is available as a resource, and that culture breakdown of like, no, you can ask for help. So that's my question of what happens in the off hours, and how's that other component piece of the marketing and letting the other teams know that this is available?
Yeah, good questions. So for the gap hours, right? The reasons we picked the hours that we did is because those are the highest hours for call volume, that noon to 10 p.m. And then we launched the 7 a.m. to 5 p.m. unit specifically to match the school system, so that we could help the city of Santa Rosa school systems as well. And the students, our youth, are really clear about wanting a different response and asking for us, and they have done a really great job of that. And so for those gap hours at night, law enforcement will respond to those calls if appropriate and needed, right? Sometimes people will call in our number and they'll let the individual know that our team's not on, and that they can call back in the morning. Or if it's a crisis response that they need, that they definitely can send law enforcement, right? And so how dispatch works is when you put a call in, that call stays active until it's no longer active for whatever reason, right? So they can't put those calls just on hold and wait 12 hours, right? Because that call just stays active. So what happens is, what we've done is we have built a really strong relationship with our police officers. And so I get personal calls that says, hey, we went on this call last night. Can you help us out? And will you have the navigator, or will you call the family and reach out to see if they need any extra support, right? So our police officers really, really work with us and are really excited to have us as a resource. So there are times that it happens. That's not every single morning thing that happens. And then other agencies, right? So, I work closely with all of our EMS systems and our providers. I don't think that there will ever be enough outreach, right? I know for myself, I have my own mental health experience, and that is a process. I've been an EMT. I've worked in this field for a really long time, and there's times like I got it, and times that I don't got it, right? So I think that's going to be an ongoing process of like continually to remind folks, this is how you utilize us. You can call us if you don't want to call through dispatch, right? Like, these are different avenues to get support, right? So I think that's an ongoing process, but that's also my ask from community and from all of you too, right? Is talk about us, talk about mental health, right? It's important to continue to talk about what mental health wellness looks like, ways to get support, way to engage, right? How to access those different points. And there's so many different choices. Actually, in the county, we have quite a bit of resource, right? So then it's learning how to navigate that. So continuing to talk about that piece is really important.
Thanks so much for being here, Katie and Erica, and for presenting on this. And this program is really exciting. I still can't believe that it's here in Santa Rosa. I can't wait to just see it grow and what comes out of it. My question is regarding the community response to this, because what I've heard has been really positive, and people also excited for the presence of In Response here. And I attended the community meeting that happened at LC Allen. For the most part, it was great, but I did hear a few misconceptions about, for example, emergency rooms and how this could impact people ending up in emergency rooms. And so I just wanted to hear from you, your sense of how is the community responding to this? And then are there any misconceptions that we could help dispel or we could help spread the word about?
Yeah, overall, we've had really good community feedback, right? I welcome all community feedback, right? Because I think that's important because there's always avenues we're gonna miss, right? I'm queer, and I have had a lot of our queer community come to me and say, I don't know if I could trust you, right? And I get that, that's fair, right? Law enforcement, I would love to say, and I won't say this, that we're a completely non-law enforcement response, right? There will be times, like I talked about, that law enforcement will have to come with us for help. Right, and so I think it's continuing to build those relationships for folks of explaining when law enforcement comes, being really transparent about what that looks like, so that folks know what they're calling for and what the response looks like, right? So I welcome any community feedback, because that's how we learn. But overall, in general, we've had really good community feedback. We've had, I've heard even like down to the logo inside of the van, right? Like I was told that like, hey, we don't like that. That's almost stigma producing for us, right? So like, it's fine, but like when you show up at my house, that doesn't feel so great, right? So overall, good. I think a big piece of it is around like misconceptions. I think we're all learning together, right? What In Response has done is we've created a different response model amongst our system. And what that has done though is really highlight some of the system challenges in our community, right? Like we have bottlenecked up services, right? Trying to get in the pandemic, we had a health crisis and we have a mental health crisis, right? And so that's what we're seeing, the height of this. And so the throughput into crisis services, into hospitalization, into getting an appointment with a provider, all of that takes much longer now, right? So the stress of that is felt across the system, and especially for the individual and family accessing those services, right? So I think that's been the piece that we've learned, is pulling providers together to start to have that conversation so that we can look at where the challenges are around
I would just add to that, I reached out to the program coordinator. So in ACP and Sonoma County Black Forum launched the Black Therapy Fund, which is a network of about 41 culturally competent BIPOC identifying providers in the regional Bay Area, providing mostly telehealth, but a number of them have expressed interest to be of service in the community. So Demetra will reach out to the email that you provided to just begin to bridge that gap. It's free. So especially for those who are waiting for coverage and services, it provides them at least 12 sessions, and maybe some of the providers would be available or interested to be physically present in the region as it may be necessary.
It's a fantastic resource.
I am looking around the room. Does anyone else have something that they would like to bring forward? Okay, well, I just want to start by saying I so appreciate, sorry, go right
I'm
ahead.
slow on the update. I'm sorry. I'm just curious, you mentioned that you welcome feedback. Is there a specific way that people should provide feedback for?
They can do it through the email, they can call me. I mean, they can do it a variety of ways, but they can reach out to me directly as well. Thank you.
My question relates to, how do you deal with crises where people aren't fluent in English or Spanish?
Yeah, so good question. So we currently have a language line where we use translation services for in those moments. Our team is, we have bicultural, bilingual folks. So we have a lot of folks on our team that speak Spanish, and our navigation team in particular serves a lot of individuals that are families that are monolingual Spanish speaking. So that's a piece of it. But currently we're using language line for other languages, which is a step in the right direction. I think that we can grow in that capacity. We have video translation too, that's live. That's definitely better than just over the phone.
Is there outreach to other groups that are that speak different languages other than Spanish or English to let them know about In Response?
We have done some, but not enough. That's the area that we need to grow in. Good question.
What's the bandwidth for that? That's a great question. Like, what's your bandwidth for engaging I know you guys obviously don't have, all the money in the world. So how much can you actually devote towards doing some of this outreach work?
So we share the outreach side across our team. So I will do it. Our folks that sit on the unit will do it. Our navigators do that. So we try to do as many events and outreach opportunities that we have access to. So we're game for it.
And I'm sure, Henry, you would probably agree, like if there is an interest from a community organization, they can just contact you directly.
Yes, I would love that.
That's terrific. Thank you. Thank you. All right. So learning from my prior mistake, I'm going to pause for a few seconds. Oh, 7 seconds. Thank you, member. That's good to know. Are there any other questions? Speak now, forever hold your peace. All right. I'm not seeing anything. All right. Thank you, clowns. I just want to start by thanking you so much for your candor and especially for your vulnerability. It's very refreshing and I appreciate it. I'm sure a lot of us at some point or another in our lives have had some sort of mental health issue. It's not something that's unique to any particular individual. So I really appreciate that. That being said, are there bite-sized pieces of social media that you guys can share with us that plug and play kind of deal or?
I don't know to think about that for a minute. We post different things, but I could talk to, we work with the San Francisco Police Department's communication team, and I could work with them that help us with some of our social media stuff that we could see if we could create that for folks to share. Because we do that around events and things, but not specific things to send out for other organizations to share, but that's a good idea.
I mean, honestly, I could probably just go to the social media pages and take the content and make something out, figure it out, ask, because you never know if an organization just has it ready to go and then just can give it to you. Like sometimes they do, sometimes they don't. Either way, it doesn't really matter. I can make do, but I figured I'd ask in, either way. And the other random thing, this kind of riffs off of what I think member Ram was discussing earlier in terms of I'm not a brand strategist or a genius in any sense of the word when it comes to marketing, but what about QR codes on your van? Is that something that would be acceptable?
We don't have a QR code on our van, but we have them on the back of our cards and on our brochures.
Yeah, because I mean, just in the digital age, it's super easy, obviously, just scan it. And if they were on your van, I was thinking, well, then if, you're parked at some event and maybe they don't come to your table, well, they might see your van and scan it like, oh, what's in response? Wait, say again, what?
Just trying to cause some wrecks on the road or something.
We got to keep our law enforcement busy somewhere, another, I'm sure Chief Cregan will appreciate that comment. Yeah. Great. And it sounds like in terms of advocacy, the thing we can do is just share it on social media, Nextdoor, all that, and just try to amplify all the work you're doing. So that's all I really got for you. And I'm sure you actually know one of our mutual friends, Mary Frances Walsh. She is in a leadership program with her, and we all love her dearly. Wonderful woman. So very happy to see you partnering with her as well. So with that, again, thank you, Member Lynch. Is there any additional questions? I'm not seeing any. With that, I will thank you very much again for being here. Much appreciated. And we will move to public comment.
There are no hands raised for public comment, and I don't see any public comment in the room.
Thank you all for having me tonight and chatting with me. Appreciate it.
All righty then. We are going to move right along to item 6.2, issues of concern to city residents. Do any of my fellow members have some community news of interest that they'd like to share with us? Member Lang.
So I was at the leadership course group last week and collected tons of feedback. One that was really prevalent was the quality of parks around the city. And especially since so many neighborhoods have neighborhood parks that don't have updated equipment or functioning restrooms, things of that nature is really concerning for folks. So feeling like they need to go into different neighborhoods to have quality park equipment for their children to play on, and left with the sentiment that folks are really curious if it's a funding issue or if they need to rally behind and, I don't know, put something together as a community or neighborhood group to ask for, you know, a re-beautification of the parks in their neighborhood. But the disparities are definitely there. And I can say firsthand, like Juneteenth last year, being at MLK Park with, you know, hundreds of people and the bathrooms weren't working. And the cost was, you know, put onto the organizations co-sponsoring the event to pay for porta potties and washing stations. So when we think about, you know, I don't know what the real answer is, but thinking in that situation, you know, smaller groups being tasked to pay for things that should be functional through city infrastructure in a way. But I don't know what all those barriers could potentially be, but especially knowing that that's a park where an annual event was birthed and continues to be held, should probably hopefully be prioritized among a number of things. And then the other piece that came up where I know this is more in the permit and zoning conversation, but there's a lot of concern around where dispensaries are being allowed to be opened up, and a number going up in communities where there are programs or services that serve vulnerable populations. One going up recently in Roseland that is near a program that works at-risk youth and trying to right them on the path from drug and substance use. And so to have the dispensary be across the street makes for those program coordinators to have a pretty hefty task. And so it made me also wonder, much like our exploratory project with the bus stops, where there's an opportunity to kind of think through encouraging our peers on the planning commission to think about some of the zoning that takes place and what programs are where and who's serving who, so that these types of predicaments are not so precarious for those trying to provide services in community.
Great, thank you so much. And I'm sure the city staff are taking note and we'll communicate that. So excellent, yeah, and it's a great point to raise. Does anyone else have something they would like to mention? All right, I am seeing none. I can't say I have any immediate concerns either, but I do appreciate Member Lang sharing that. So with that, we will go to public comment.
There's no hands raised for public comment, and I do not see any hands raised in the room. Thank you.
Wonderful. All right, moving right along to future agenda items. Does anyone have something? Member Rodriguez.
A couple months ago, or then the end of last year, we had a whole discussion about an emergency event or an emergency preparedness event. And I just want to get an update on it at a future meeting, if it's happening or not. So we had quite a lengthy debate and discussion on it. So just want to see if it's something we're going to move forward with or not. We'll have an update on that.
So my recollection was Magali was the lead point person on that. And that was, so they'd had the event on the square. Well, they've had a couple in partnership with the fire department, and Danny, you can, well, so we had the we had the radio giveaway, and then we had on the actual square, there was a collaboration for fire emergency preparedness. There was a whole event day around that. And there was a conversation that Magali had with us, you're right, in the fall about this year's event, and all the partners were going to be part, and CAB was going to be a part of that. So that's just kind of bringing you guys up to speed with this. So I don't know with Magali getting a new job, I don't know if that's on hold potentially, because it hasn't been brought up.
Thank you, Vice Chair. We do plan on hosting a public safety day sometime this summer. And We absolutely would love you all's participation. And so what I'll do is I'll have staff agendize this at a future CAB meeting for further discussion.
Yeah, my recollection was we were actually going to be somewhat responsible, I think, for actually executing the event. So I'm glad you brought that up because honestly, it kind of slipped off my radar. So, and I know that the clock's ticking. Yeah. So I'm glad you brought that up.
Yeah, well, I just want to just clear up, no, you all will not be responsible for hosting and facilitating the event, but we would love for you all to be a partner.
I mean, I'm always ready for a great event. So, call on us when you need us. Does anyone else have something they would like? Member Holder, go ahead.
Sort of along those lines, I was at the same event that Kirsten was at, and I did hear from, and this was a room full of folks who self-proclaimed leaders in the community, I guess. Even in that room, people didn't know what CAB was. And so my question, and I'm very new, and so this is probably mainly for me to learn, is how is outreach about CAB and feedback to CAB done in a systematic way, so that it's not just, oh, I happen to run into one of the members of CAB, and that's the only way that you can get feedback to us. What is done, and if there's not a lot of outreach that is done by CAB as an entity, maybe that could be something we talk about in future.
But I think that, and I'm going to leave this to Chair Weeks, I think that dovetails with the one-on-ones that Chair Weeks is having with each and every one of you all. And then we'll continue to have regular meetings with Chair Weeks. I think we have an awesome opportunity, all of us, to reset, to revision, re-envision the role of CAB and how CAB partners or better partners with the city to advance our shared goals, right? And so you're new, I'm new, Lon's new, Cal's new, right? We've got an awesome opportunity to really shape, what we think can be most effective for our community.
Yeah, and I'll say what's exciting is the fact that we have a very impressive group of people in this room. So I think I speak for all of us when, we stand at the ready. So I'm very much looking forward to having those conversations and seeing what we can do to kind of propel us forward. So I'm sure we'll chat. Does anyone else have anything they would like to place on the agenda? I am not seeing any hands, and I know this is something we probably take offline. I know at some point we're going to be discussing town halls, I believe.
Yeah, so right now we're actually working on a plan for merging communications and the community engagement department. And in that, we're kind of revamping what that looks like. And so there's some digital things that we're looking at, and then trying to really connect the dots between what you guys are doing and what we're doing. So like a lot of these notes I'm taking, it's not like, oh yeah, I'll think about it. Like I'm actually going to make changes. So like connecting with Katie, and like our team is the one that coordinates with the police department to connect those dots. We're talking about, when we're talking about like CAB and its new vision, I absolutely look to partner with you guys in a more extensive way to make changes that are impactful. Our team in communications has always supported community engagement. And so I think it's like by merging those, it allows a lot more resources to be applied to this group and the things that we're doing, like the presentation tonight, trying to make sure you guys have the latest information. We're regrouping at the city standpoint with communications and engagement to make sure that we have resources, that we go out and do something, we do it well, it's resourced. And so for me, to Darrell's point, I'm excited because I think there is a lot of opportunities to reconnect with this group in multiple ways. One, to your point about CAB, like I'm asking the same questions when I got here. It's like, what is CAB? What do they do? What is their role? There's a lot of opportunities for me to relay information to you, take information that you guys have to the city, bring things that are relevant back to this group and start making changes. We're bringing back, it's part of the upcoming agenda, Civic Ready. My team oversees Civic Ready as a product. We also worked closely with police and fire to roll that out. We heard community concerns. We immediately made changes. I heard it back here at the CAP. We're coming to bring a presentation to tell you about what we've heard, what we've changed, and how we can do things better. So I personally will tell you, I'm excited for the opportunity to kind of revision what this team looks like and how we can bring information to you guys also within neighborhood groups and people throughout the city to really reinvigorate more people to participate in this group, actually to have some public people come. So I will just tell you, I'm personally excited. I think there's a lot of opportunities to coordinate with the chair and the committee to expand the interest in CAB and connect in a way that we haven't done before. That's it.
Just a quick thought, one moment, Member Lange. This is something we can discuss at a later time in terms of location, of whether this is the best location, if it's central enough, if it's a good location. I mean, it is right near a bus stop, but maybe it's something we could discuss down the line. I will hold my other comment. Member Lange, please go right ahead.
I don't think location is the issue. I think people just don't know what we do and why they would need to feel inclined to come here, which is the sentiment I gathered from being at the LSR class. And I'll say, like, for me, I understood what this group was about because I've always been civically engaged. So I waited 10 years for a spot to open up to get onto this group, but it's because I knew what to look for. I think a lot of that just like basic civic engagement conversation is not happening on a regular basis, but that's a conversation for another day. Agenda items, we did a whole lot of like strategic plan conversations and meetings. I don't really remember where we left off fully in our like action items, but is there at some point, can we bring back maybe like a pulse check of the things that, I mean, those meetings were really long and I don't remember a lot from them, but I do remember that we like said, these are the things we want to prioritize. Can we do like a pulse check in like maybe May to kind of see where we landed, what pivoted, especially, or what we need to like reprioritize. I know there was a lot that happened in that time seems really foggy because it's been a while. The other thing I want to ask is for the My Santa Rosa app presentation, whenever that happens, can we ask that actually include data and metrics around the use of the app, response time if people are putting in service orders? And I say that because I work in Marin 3 days a week. And during the rain, I put in a request on their app. There was a 4x4 pop hole in the street. And when I finished my job, I went back out to get on the freeway and it was patched in a 3.5-hour window on a Saturday. So they set a pretty high standard, but it made me wonder what are some of the outcomes potentially from our app and service, and where could we be thought partners of helping our community have realistic expectations based on the resources.
Member Rob, go right ahead.
So to dovetail on that, so I've used that app quite a few times and I actually got a response for 12 hours. So that was great. But it was not the Santa Rosa app I called it Transportation, which is another resource that you guys have a team that goes out and somehow that needs to be, I mean, it'd be great for us. I'm in social media, but there's a lot of people that aren't in social media. So how to reach those is always, Ron and I talked about that previously. How do we get to those people? But really even if you guys got us something that are social media ways that we could give those to people to understand through either just door-to-door knockers or in the mail or something, but also have that digital media that we don't have to retype. Like I literally will go and respond, and then put it in my Facebook page. And it'd be great to be able to get like some pre-loaded something you can send us and we could upload onto Facebook or Instagram or whatever. That was one thing. And then the other thing was, I completely forgot because, My Santa Rosa app, we would like to, there's a lot of people that show interest in it. but they don't feel that anybody responds to it. And to understand the process of when it comes in, it gets dispersed to who the department is, but they don't, it just gets probably taken off the app. So once it gets sent off to, there's garbage on the side of the street and sent to the garbage guy, they take it off the app because it's done. And so the people are looking on the app going, and they're relogging it, saying, I put this up and no one's doing anything about it. So just understanding the system. So when that does come up, I'd like to get on the agenda sooner rather than later so we can let people know, because there are people that you got to build confidence in our community that that app works and to use it. So that's all. That's my rant.
Rant away. We'll absolutely bring data to it. And we are looking at improving it for sure. So it's one of the things that, in addition to our website being revamped in the next, well, hopefully by the end of the year. So we're currently working on that, which will solve a lot of these connection pieces with our newsletter that we do, connecting it to the homepage and our social media and like a little more bite-sized pieces, which is really what you're talking about, Stephen. I know we did talk about it, but it is a work in process. It's interesting with the app, and we'll go over it more when we bring it to you guys, is that there's both the digital app for both iOS and Android, but also that same app is a web app online. And so it's been interesting to see how communities using it, but also then the city employees are using it to input stuff into it and the other into the web app portion. But we'll bring something that highlights like the process. So like, where does this stuff go? So yeah, and so we're also updating it, trying to reconnect it to crisis communication elements, which is really important for the city from that standpoint, is using it in like post-earthquake to like designate issues. So we've been testing a lot of stuff, but there's definitely room for improvement, starting from our website, moving over to the app. And one of the things I think would be helpful, and I'll bring this back and the next time when I do my step updates, is I just rolled out something where it's like top 10 ways to connect and engage with the city. So it's on our website /top 10. And I think it highlights, what's that? Thanks. Yeah, it highlights just just very simple ways to engage. There's a lot of complexity from the city, to your point. There's a lot of different touch points and inputs. So I think for at least me, it was like, look, anybody in the city needs to quickly say, oh, here's the easiest way to do this. Sign up for a newsletter, get, the difference between this and that. So there is a lot of complexity, especially with our crisis communications, SoCo Alert, Civic Ready. There's different pieces, and then people are like, well, which one do I use? And so if everybody in this room is up to date on what's going on, I think, and then we continually pushing that out to the community, I think it helps. And I think, but one other piece to this, Ram, is also like coordinating with you guys to also be ambassadors and to put that word out. And so one of my things, for at least in communications, it's like, yes, I want to get information correct, but my main thing is I'm looking at reach. Like if I'm gonna do something, whatever it is, and spend an hour on something, 2 hours, like I want to put forth effort that actually has a very broad reach that is impactful to the community. So versus spending 50 hours on something that goes to a class that 10 people are going to be involved versus a mass community event. So that's a lot of the stuff that we're looking at. And these tools, digital and like basically in coordination with our IT department, looks at it as like the virtual city hall. So like all these services that we're doing is really extending the city's presence and services and engagement opportunities 24/7. And we just, and I think looking at our web stats this year, we went from 2 years ago, 3 million to then 2 years past, or so 3 million, then to 4 million. And now in the last year was up to 6 million. So we've seen a significant increase in the digital presence. But we also want to meet that in a way that is meaningful, to your point. So if people are using the app and it's non-responsive, we need to change that for sure. So we'll bring that back and have some conversations for sure.
And you just said app. We were told the app doesn't work. It's only by web-based. So I've been telling it, and because it didn't work for a long time. So that's the only method that's being used right now, I think. I mean, the people that I know, because we were told it doesn't work.
Well, we definitely need to have conversations. So since I've been here, it's worked, but again, yeah. Please put it back on your phone. Let's have more conversations around that, number on. And we will bring it back for the web app as well as the digital apps on iOS and Android. You're welcome.
Wonderful. Oh, Member Barnett.
Real quickly, to tie into Amy's question, one of our outreach, the way the community knows about us is through the most predominant way I've seen is the Community Improvement Grant, CIG. And I wanted to remind everybody that the next application deadline is March 31st, 2023 at 4 p.m. And so this board, one of our tasks is to get it out to the community that we have these grants available for community improvement projects. And since we're talking about future agenda items, FYI, Danny, April will be any and all community improvement grants that came in. If we could get our budget ahead of the agenda on that one, because I have a feeling that we're right coming to the wire. And since I have the assistant city manager in the room, do we know in the budgeting process where CIGs, in other words, are we getting, my question is that I hate seeing no and I want to bankrupt this fund. That's my singular goal on this board is to have as many grants as possible and to run that number down to 0. And I'm just wondering if we do that and the next cycle opens up because it's in a quarterly system, is there going to be a funding commitment? That's my question.
Yeah, so we're as a city, just starting the budgeting process. And so we won't know for sure how any of these numbers shake out, not just for CAB, but for departments and other fiscal responsibilities. We won't really have a clear picture until May.
All right. Well, I know me, the chair and the vice chair can take lead on hammering that home. But those were all excellent. Thank you so much. Especially the strategy discussion. I couldn't agree more. I think it's definitely a really good opportunity for us to revisit that. We've got a lot of fresh faces here and potentially, different perspectives on how we should proceed. So let's start fresh. Let's take another, look at it and see, what direction we want to take. So that's a fantastic idea. And I +1 that. So we'll talk more about that. Does anyone else have anything else they'd like to say? Any other future agenda items? Yes. Thank you. Well, now that the 7 seconds has been achieved, can we go to public comment, please?
Yeah, there is no hands raised for public comment, and I don't see any public comment in the room.
Excellent. All right. And we have reached the final item of tonight.
Motion to adjourn.
Adjournment. Oh, she beat
Second.
to it. All right, we are adjourned. Thank you so much, everyone. Have a wonderful evening.
Thank you.
I was going to say member range's favorite time of the evening.